I now have the pleasure of introducing someone who's leading innovation on the opposite end of the country. Andrea Palmer is an entrepreneur, an autism health advocate, and these are her own words, exponential tech geek, based in Vancouver, BC. She is the founder and CEO of Awake Labs, an autism health company committed to empowering those living on the autism spectrum. Andrea is also a World Economics Forum Global Shaper in the Vancouver hub. She's an entrepreneur motivated by social impact, quantified healthcare, and democratizing technology. So would you please welcome to the stage, Andrea Palmer.
Hi everyone, as you heard, my name is Andrea Palmer. I'm currently based in Vancouver, but we're moving to Toronto. So soon we'll be working on both sides of the country to empower individuals living with autism. I'm going to start by telling you a little bit about myself, because that's how every great speaker starts, right? I'm just kidding, but I'm going to do it anyway. So I am an engineer. I studied robotics. Up into this point of starting this company, my biggest accomplishment was building autonomous soccer-playing robots and competing them around the world against other nerds from other countries. And then somehow I ended up working in the healthcare space, in the autism space, right after graduation from UBC. This is my business partner, Paul. He's a biomedical engineer. He's slightly cooler than I am. And together we're leading this company to change the way that individuals with autism navigate the world and how the world is aware and accepting of them. So to start, I'm going to say a little bit about the technology that's changing healthcare right now. We heard a few things already. One of the things about wearables changing the healthcare space, I want to expand that a little bit and say wearables, implantables, edibles, these are all things that kind of go hand in hand but sound kind of crazy. I have some examples, but one I forgot to put on the slides is the Waterloo-based Thalmic Labs. Have any of you heard of Thalmic Labs before? No? So in the back, great. So they started out building just really cool technology that they wanted to change the way you interacted with your computer or with your TV. And so they have this arm-based device that you can turn your hand and it recognizes your muscle movements, or you can make gestures with your fingers and it understands what you're doing. And really their first application was changing the volume or changing the song. But recently they have been using this as a brain-computer interface. So helping people with amputations or who are missing limbs interface with their prosthetic limbs through their muscles, the remaining muscles in their arms, in order to help them or empower them to navigate the world and be more independent. So it started off as this thing that was like, yeah, change the volume, great, and became this like amazing project. And they recently just raised $120 million in their Series B. They're 3 years old. This company is 3 years old. They raised $120 million, which I think is the largest Series B round in any startup in Canada. So that's one company that's definitely growing, and they're based right here in Ontario. Another one in what city are we in? Ottawa? Is the iBionics. They're the creators of the Diamond Eye. I think this company is only a year old, and they were just named the most innovative startup by Startup Canada. And they're creating an implantable chip to go into your eyeball, and it helps people who are born with sight and have since lost their sight as their retina degenerates. And this helps restore their sight as they grow older. How crazy is that? They're putting like a little chip that has diamonds in it in your eye and it helps people see. Okay, and two other companies. So Newton here is based in Toronto as well. They are using the Pebble smartwatch to help monitor epileptic seizures. And Empatica on the other side, they're based in Boston. They're doing a similar thing, but they created their own device. This is the Proteus Digital Health. This is an edible system that's changing healthcare. So they create these little pills that are essentially little robot sensor things, and you swallow it, and it's to improve medication compliance. So if you send someone home with a prescription, to be sure that they're actually taking their prescription, you give them this system, you put the medication in the pill, and they wear the patch, and it will tell you if they've actually swallowed that pill. Crazy. And this is Docto. They're based in Vancouver, and they're using a Fitbit and a glucose monitor to predict, for type 1 diabetes, to predict moments of hypoglycemia. It's a completely autonomous system, but it will notify you if you need to eat sugar. And then something super crazy, there's companies, multiple companies, this is just one of them, that's looking at aging as a disease and trying to figure out how we can cure aging so we can live forever. But these are also the crazy people who are planning on sending robots to asteroids to mine them to bring back resources for Earth, so we'll just write them off as crazy. I'm just kidding, they're really cool. Okay, so how many of you know someone who is on the autism spectrum? Yeah, quite a few. So I'm just going to tell you a little bit about autism. You probably have heard it before, but right now, 1 in 68 children in North America have an autism spectrum disorder. 85% of these individuals will require continued support throughout their entire lives. And that support really varies. It's anything from full-time, 24/7 caregivers to seeing a psychologist or a behaviorist once a week throughout their lives. But this is a huge number, and we really need to do more earlier on to increase independence. 90% of adults on the autism spectrum are unemployed or underemployed, because so many workplaces are just not set up for them. So this week I'm attending the Geneva Center for Autism Symposium in Toronto, and in our little gift bag they handed out brochures, and one of them was for a chair for classrooms. And this, I had never thought of it before. I think about this all the time, and I had never thought of this. This chair has tennis balls on the feet, or essentially, it's a little bit more elaborate than that. But the idea of the chair in the classroom, have you ever been sitting the linoleum tile and someone pulls the chair back and it's really, really loud? Well, with the additional sensory challenges that come with autism, that chair being pulled back can cause anxiety that means that individual will no longer be able to focus in the classroom. So this chair with tennis balls on it will reduce the noise, so autistic individuals in classrooms can focus on their learning even more, reduce one of the sensory challenges that happen in the classroom. Autism in Canada is, we have one of the best systems, I would say, for supporting autistic families. But it really varies across the country, and there's no national strategy. So as I have been looking up, autism policies in various provinces, I found that the last time the federal government looked at this was in 2006. And in 2006, the rate of diagnosis was 1 in 166, and right now it's 1 in 68. So that's a pretty big difference. And Senator Jim Munson, whose name I spelt completely wrong here, so forgive me. It's with an O, not an E, fun fact. He said that, I really like this quote because I really like it, but it's also very hard or difficult. It says, autism is an equal opportunity neurodevelopmental disorder. So it doesn't just affect, it's not a partisan disorder, but it's something that we all need to focus on and come up with a strategy together across the country. In Canada, families with one child on the autism spectrum will spend between $60,000 and $80,000 each year. And when you look at the median income rate for a family in Canada, it's $75,000 a year. So these numbers don't really add up when you consider all the other costs that also go into existing on Earth. And many times, especially for families who have more than one child on the autism spectrum, they are forced to move across the country to BC or Alberta or provinces who have more autism support. But in BC, for example, the provincial government gives $22,000 each year to a child under the age of 6. As soon as they turn 6, that number goes to $6,000 each year per child to help with therapy, for technology, things like that. But the average age for diagnosis in BC is 6.5. And so right away, we're missing out. In Ontario, in Ontario, the average age for diagnosis is about 4. And the provincial government supports programs called IBI therapy. It's a type of behavior therapy up to the age of 5 in the province, but there's a 2-year wait list. So if the average age for diagnosis is 4 and there's a 2-year wait list, oftentimes, as soon as a child is diagnosed, it's too late, or they get 5 months of support. And so this is where, here's another number. Can you see that? Here's bigger. In the United States, the UC Davis just did a study that said $268 billion is spent each year on direct medical, direct non-medical, so that's therapy, speech pathologies, and indirect lost productivity costs of managing autism. This is 1 year for one disease in the United States, in one country, $268 billion. It's mind-blowing. Oh, man, there it is again. Okay, cool. So here's what we're doing. We are building a tool to measure and track anxiety for children with autism and for adults with autism and for anyone with anxiety. But we're starting with children with autism for a number of reasons. The first reason is that early intervention increases independence. Do you remember that 85% number? 85% requires continued support throughout their entire lives, and 90% are unemployed or underemployed. We want to better understand anxiety and know when anxiety is increasing to predict and prevent behavior meltdowns and allow autistic individuals to have or empower them to better understand their own emotions so they can navigate this world that has all these noises and bright lights and various factors that challenge them in their day-to-day lives. Here's how it works. We have 3 physiological signals. It goes on the wrist. It's heart rate, electrodermal activity, which is a fancy name for sweat, and skin temperature. And it looks at these 3 things over time, sends that over to a smartphone, and the smartphone is really where the intelligence or the brains of the system is. We look at analytics using machine learning and deep learning, which are super cool technologies. And fun fact, the leading deep learning researchers are here, Ottawa, Toronto, Montreal, some of the founders of this type of technology. So it supports healthcare, it supports the energy industry, it supports everything, so cool. We are doing this to, as I said, empower care, to empower autistic individuals to be more independent, to understand their own emotion, but also to help parents, because parents, when their child has an autism diagnosis, are not only parents and friends to that child. They have to be experts. They have to be advocates. They have to understand how their child, what type of support their child needs in the classroom. And that's a lot of responsibility for someone. And so we want to be able to help them provide these analytics so they can see what's going on, trends over time, so parents can become more informed, untrained experts. A lot of the parents we work with have since taken on a training course or something to become a behavior interventionist or to better understand autism. So as I mentioned, we're doing simple personalized behavior tracking that goes along with the 3 sensors to better understand anxiety. We're using deep learning for anxiety insights. And really our goal is to improve focus and learning in the classroom by better managing anxiety, increase independence through early intervention, and transition to the workforce. One really important thing is that when you're dealing with any population or designing for any population, you have to include them in your design. And so from the very beginning, we've been intentional about working in the homes, in the classrooms, with autistic individuals and their families and the people who will be using it. We're not working out of a research lab, probably because we don't have one, but also because it's really important to be there with people. And to include autistic individuals in this design. There's so many cases, like the movie The Accountant, that shows this autistic savant, and they did not consult a single autistic person when they were making that movie and designing it. We have the support, I'm running out of time, so we have the support of a lot of really cool people who are doing, who lead autism organizations or caregivers or educators. We have the support of the federal government through the IRAP program, the National Research Council, which we really appreciate. And also we've been using the Trade Commissioner's services because autism is not a disease that's limited to Canada. It is definitely a global issue. And so we've been going to Boston and Tel Aviv and Atlanta and all these other places to figure out how we can connect with those communities as well and incorporate it into their worlds. So we started our first study with the support of IRAP in May, and in January we'll start our pilots, pilotitis as I heard earlier. We'll start our pilots of testing in the real world in 3 different countries, because that's important, and then we'll be full sales by the summer, so we're still in development. And we really see this as being a platform to go to senior care and dementia care, where very often the same untrained caregivers are working to take care of their loved ones. And a tool like this will be able to help them better understand how they're feeling. And also for addiction and clinical stress and anxiety and PTSD. And we have a whole blue sky world, but we're starting with autism. And thank you so much.
Sit down and have a chat. Okay. Thank you, Andrea. So I get the privilege of, thank you, here's a microphone for you. Thank you, that was incredible. I don't know how many of you have done so, but I knew I was going to be sitting here face to face with Andrea, and so I spent a moment looking at her LinkedIn profile, and if anyone would like to feel like a underachiever, then I strongly encourage you to look at what this young, incredibly talented woman has accomplished in a very short period of time. You graduated last spring and have already had global recognition. I figure when your university recognizes you as the alumni of the future before you've ever left the school, that you've got something going on. So congratulations.
Thank you.
We started off this morning talking about health and healthcare, reframing the conversation as an economic and prosperity agenda, and not just from the perspective of starting companies and supporting companies, but really from driving outcomes that help Canadians live their best lives and participate in their communities and their workplaces, and ultimately in the country broadly, and what that means for this prosperity of Canada. My question was going to be, do you see the application of Reveal in other spaces, particularly in terms of brain conditions, which you actually touched on at the very end? But what are you hearing from the people who you're working with, the people who are using this technology, maybe the early adopters, in terms of how it's changing their lives so that they can live their highest potential?
It's pretty incredible right now because we're not on the market, and we used to have a lot of media attention. Right now we're focusing on building the product because that's important. And like multiple times a day we get emails from people who are looking for any resource that they can online to figure out how they can manage anxiety, how they can help their child have less meltdowns or better understand how their child is feeling. And they find us and they send us an email and they said, here's my story, here's exactly how I see Reveal coming into our lives. How can I buy this? And right now we have a pre-order page on our website, and I'm blown away by the people who we've never engaged with, who don't even send us an email, who know nothing about us. Maybe they do some research, but like they find our page and they pre-order a device just like that because they need something that will help them. And then there's also people who don't have autism, who are wondering if they can help them with their generalized anxiety or with borderline personality disorder. There's this woman from Finland who has borderline personality disorder, and she wants to be a mother someday, and she doesn't know if she can keep her children safe. And she thinks that Reveal might be able to help her regulate her emotions well enough in order to have children and become a mother. And it's just like, it's incredible and so motivating, but also terrifying that we have so much kind of riding on what we're doing. But yeah, it's a good place to be.
That's fantastic. So thinking about what's riding on what you're doing, you're here from Vancouver. You've got a room full of people in Ottawa. Some of them, like Mr. Chernetsky over there, are making very important decisions and driving new conversations and new opportunity. What, on behalf of, you are a Canadian, you are building what I think you think of as a global company that happens to be located in Canada. What is the one thing or one or two things that you want policymakers, be them health policy, finance, industry, trade, what do you want policymakers to understand about what you and your peers are trying to accomplish so that they can help you drive the kind of impact that you envision for this and other interventions?
Wow, so many things.
Well, Bill's not going anywhere. He's here for the day, right?
Hey, Bill. The biggest one, so going back to those numbers of the amount that families spend right now on support, on therapy, on speech pathology, things like that, and the median income. And it's really unfortunate, but there are, the rate of divorce for families who have an autism diagnosis is much higher than families who don't. So very often it's a single income family, or there's one stay-at-home parent or something like that. So the biggest thing is really, taking, putting resources towards supporting the families. And right now, so I mentioned BC, the under 6 years old, 6 to 18, but as soon as these individuals turn 18, there's no resources, there's no funding. And so families need to make a decision, how are they going to support autistic adults as they grow older? Do they put them in a home? Do they stay home and take care of them? Do they hire a caregiver? What do they need to do to support adults, autistic adults? And that's a really big thing that just isn't being addressed right now in Canada at any level. At any level, excuse me. So I think that's probably the biggest thing. And then worldwide, or as we expand globally, sounds silly, but the trade deals are really important for us to be able to export devices. And so maintaining trade agreements is, don't let it slip. We need that.
It's not silly at all. It's not silly at all. On behalf of the group, I would really like to thank you, Andrea. And on behalf of those of us who are not in our 20s, I'd like to encourage that group that's working on the cure for aging. Don't laugh at them, encourage them. Thank you very much.
Thank you.